A new therapy option for treatment of dry, age-related macular degeneration and Stargardt disease by removing lipofuscin and melanolipofuscin from the retinal pigment epithelium. A small drug called Remofuscine was recovered that was able to remove lipofuscin from RPE cells. On the left side you can see the structural formula of this drug and the full chemical name. The original name is Zoraprazan. We, however, call it Remofuscine, which was initially developed in gastroesophageal reflux disease for oral administration. It was tested in 1,000 subjects and patients for GERD effect. It was reported as safe in a specific ocular safety study. We know that inhibition of the proton pump is not involved in lipofuscin removal. The drug is highly lipophilic and binds to all pigments in the RPE but not to melanin in the choroidal melanocytes. Orphan designation was granted by the European Commission to Cartiro GmbH for the treatment of Stargardt disease.
Now I show you preclinical results with Remofuscine. First, an activity and tolerability study in monkeys. 48 monkeys were treated with Remofuscine during 52 weeks. The animals were divided into 4 different groups. Each 12 were either not treated as a control or were treated with 6, 12 or 24 milligram per kilo and day. From 6 eyes out of each group, electron microscopy was performed and all eyes were investigated by light microscopy.
We also performed fundoscopy. You can see 4 results from untreated or from the different treatment groups, and we were not able to see any changes after the treatment period. However, in histology, we found that lipofuscin was removed from the RPE cells. Lipofuscin is shown as fluorescent yellow spots here, and you can see after treatment there's a substantial loss of lipofuscin compared, for example, here to an untreated control. We also performed electron microscopy and quantified the number of lipofuscin granules in the different treatment groups, as you can see here, for example, and we found a clear reduction of lipofuscin granules in all treated groups compared to the untreated controls. Also, melanolipofuscin was reduced in the individual treatment groups, and here we had a dose-dependent decline of melanolipofuscin granules. The full data were published in Neurobiology of Aging. Now I will report some preclinical results with Remofuscin in Stargardt mouse models, which in principle are animal models for dry AMD and Stargardt disease. Both diseases are characterized by huge lipofuscin accumulation. We used tritium-labeled Remofuscin and injected it intravitreally, and here we looked after 1 week where the drug could be detected, and it was very clear that lipofuscin here had a strong affinity to the drug. This was indicated here by these localizations of the silver grains above lipofuscin granules. Interestingly, The drug specifically binds to the pigment granules in the RPE. It was not seen in the melanosomes of choroidal melanocytes. This is very unusual because normally the melanin has a high affinity to many drugs, but here we had a specificity to melanin and melanolipofuscin and lipofuscin in the RPE. In pigmented ABCA4 knockout mice, we could see a clear reduction of melanolipofuscin compared to the untreated control, which can be seen here. You can directly see the difference. Here this image shows an individual RPE cell which did not respond to Remofuscin and contains very high amount of lipofuscin and melanolipofuscin granules compared to a neighboring cell which had lost high amounts of lipofuscin granules. This could also be seen in light microscopy by fluorescence imaging. Here you have an RPE layer from a Remofuscin treated mouse. It was injected with an individual intravitreal dose, and here we have the result 4 weeks after injection compared to an untreated mouse, and you can directly see that the amount of lipofuscin was reduced. And also this was quantified, and the difference was quite significantly. There was a clear reduction of lipofuscin in the RPE cells after drug treatment. We also wanted to know whether Remofuscin has a rescue effect on the survival rate of photoreceptor cells. To test this, we used a double knockout mice line which had a gene defect in the ABCA4 gene and additionally in the RDH8 gene. These double knockout mice develop a real photoreceptor cell degeneration. We used 9 mice with 18 eyes. 10 of these eyes were treated, represented by the blue dots, and 8 mice were untreated, represented by the yellow dots. Here on the y-axis you can see the number of nuclei per 100 micron of retinal length, and on the x-axis you can see the age of the animals. And what you can clearly see is that the treated eyes had a tendency of better survival rate of photoreceptors compared to the untreated eyes. In conclusion, I try to show you and convince you that electron microscopy is important in retinal research. Removal of lipofuscin will improve RPE cell and thereby retinal function. Remofuscin is a likely candidate for future treatment of dry AMD and Stargardt disease.